This conference will now be recorded.
27 tip.
Any discussion on that? Questions? Now, can we get a motion to adopt the amendment?
To recommend council approval.
Recommend council approval for the TIP amendment.
Motion to recommend council approval for the TIP amendment.
Second.
All in favor, say aye.
Aye.
All opposed? Hearing none, we have approval of the TIP amendment. Great. We'll scoot right along to the MMOF funding reconciliation conversation. I believe we have Medora online.
Yeah, I was just gonna kick it off. Okay. Quickly. So in addition to the packet that I sent out last Wednesday, I also sent an email just to TAC members, which included the presentation from the June staff meeting, as well as the documentation that Michael Snow put together called the MMOF Spring 2025 Guidance. I also included the entirety of the Excel spreadsheet document, which had 3 different tabs in it. I just provided the one part of it in the packet. So that has all of the information that's in there, and that went out separately. So I'm going to hand this over to Medora to talk more about the process and what we're trying to do here today.
Yes, thank you. Can you hear me all right?
Yeah.
Okay. Hi all, Medora Bornhoft. I work in the Main Streets and Active Transportation section of CDOT, working closely with Michael Snow on MMOF. And I know he presented last month, but I did just want to give a little overview again to refresh us on why we get to talk about this today. So is my screen coming through?
Yes, it is.
Okay, thanks. Okay, so these are the slides that are in your packet that were presented at STAC in June. So as a refresher, the legislature took $71.4 million from the local MMOF program. These were funds that were sort of sitting in the account balance that had not yet been expended or encumbered to a project, but for the most part, they have been awarded out to projects by MPOs and TPRs. So this change, this fund sweep is impacting all of the TPRs and MPOs around the state. It eliminates the 2025 and 2024 allocations and a portion of the 2023 allocation. So now TPRs and MPOs are in the position of reconstraining their awards to the new allocation amounts. And for the most part, this means moving awards out to future years because the future year funding is still in place. So moving those projects out to 26, 27, 28, and 29 can help preserve the funding for those projects. But in some cases, reductions or cancellations of projects may be necessary to regain constraint for the program. So for some role clarity, the role of the MPO is to lead that transparent modification process, to regain fiscal constraint by year, and to coordinate with local agencies and CDOT on that decision making. And at CDOT, we're providing guidance and tools to help that decision making, but we are not making the decisions. We do encourage considering the contracting status, the spending, the planned schedules of these projects, and open to having discussions and providing advice, but really want to make it clear that these decisions are your decisions at the NPO. So looking across the state, this table shows the current picture by fiscal year. This top line is the updated allocations by fiscal year, showing again that 24 and 25 were zeroed out, and this 23 number is 75.8. It had been larger prior to this most recent action. The blue line shows the amount of funding that has been awarded out to projects. And this last line is the amount remaining to be programmed to projects or the amount that's over programmed. So for 23, 24, and 25 across the state, we have about $46 million that's over programmed that we're primarily going to address by moving those projects out to these 26, 27, 20, and 29 fiscal years. One thing I want to note is the situation we're in of these funds being pulled back by the legislature is due in part to the large fund balance that we have of funds that have not been spent through the program. So one of the ways we want to address this issue is by bringing down our fund balance and having a greater connection between when projects are ready to go, making sure they can access the funds. So the way we're doing that is doing a cash management approach where projects, even if they have a future year award, if they're ready to go and we have the fund balance, we want to provide the funds to those projects and keep them moving and bring that fund balance down. Based on the information we have now about the status of projects, we think we can accommodate projects, even if they get pushed out to 27 or 28, of their fiscal year funding, if they were already planning to go in the near future, we think we can still accommodate that based on our existing fund balance. If a lot of projects take advantage of this sort of advanced funding approach, at some point we're going to hit the limit and run out of that fund balance. And projects that have 27 or 28 funds may not be able to advance fund their project later on. But we don't know how much projects will be able to take advantage of this approach. Ideally, we want to get to that place where we are back in a situation where projects are using the funds in the fiscal year that they have been awarded the funds. But until we're at that point, we are encouraging advanced funding and for projects to get moving and spend down their dollars. So I guess one more note on that approach is that for projects that get their funds pushed out to 27 or 28 that are planning to go soon, we don't anticipate that you would actually face a delay in implementing your project. And next thing I want to point out is that when looking at reducing or canceling awards, we encourage MPOs and TPRs to invite project sponsors to voluntarily reduce or cancel their award. You know, in some cases, project sponsors have other ideas of where they could access funding for their project and may not need the MMF award. We also encourage looking at projects where there is not an agreement in place yet with CDOT or where an encumbrance has not occurred, where the option letter for the phase has not been issued. We also encourage avoiding partial reductions because projects that don't have full funding available to them are more likely to face delays as they try to pull together that complete funding package to let the project go forward. Okay, that's it from the slides. I do want to go back up to the guidance document briefly that Becky mentioned. So this is also in your packet, this spring guidance document. And I want to highlight this table 1. So for North Front Range, looking at these 2 different buckets of funds in 2020 through 2025, and then the out year 2026 through 2029. One thing to note about this table is it's just the state funds. So you may recall that the program, the local MMOF program, has some federal ARPA funds that were allocated to it. And since those have very strict expenditure expectations and deadlines, they are not subject to this process of reallocating and bringing our program back into fiscal constraint. We're just looking at the projects that were funded from the state dollars in the local MMF program. So for North Front Range, your updated allocation for this 5-year time period of state funds is just almost 11 million. You have almost 15 million awarded, and you have 3.9 million that's over programmed. Looking out 26 through 29, you have 5.8 million in your allocations. You've awarded 4.1 and you have 1.6 remaining that can accommodate some of this 3.9 over programmed amount from the early years. You do also have 2.2 that's over programmed overall across all of the years. So basically the takeaways from this table is that we're looking at canceling or reducing 2.2 million in awards and moving out 1.6 million to a future year. I want to pause here and see what questions you have.
Any questions for Medora? Not seeing any questions.
Okay, so then next we'll go over to this spreadsheet that you received showing all of the awarded projects. As I noted, the projects that have ARPA can't be pushed out to address this fiscal constraint. So while they're in this spreadsheet, they are not projects that we can move the funds around to address the fiscal constraint issue. We're just looking at the projects that were awarded state funds. And in here we have the amount that's been expended already in column G. We have some notes at the end about current status. And I believe Bryce is also on the call and can help address specific project status information if needed as we go through this conversation. But the thought is we could just go through these projects and see if there are any status updates to share from the project sponsor, any questions or concerns or potential projects that could be moved out or have their funding reduced or canceled. So is that a good approach to just go through this list by agency?
Works for me.
Yeah, I'm not sure if every agency that has funding is online, but we can address that when we get to them.
Okay.
Really quick, Joe, is there a way to make the,
Not usually.
yeah, that would be helpful. Or to maybe not show, I don't know if you can not show the camera. Just show the spreadsheet. Yeah, that's better. Thank you. All right, go ahead, Medora. Sorry about that.
No worries. Okay, so is someone from Greeley there who could speak about the Merge Mobility Hub?
We do have Victoria here.
Yeah, I'm here. I can answer and do my best. What are you looking for today in today's discussion?
So as Medora mentioned, we're looking at a first cut of, has anyone, any project sponsors, are they, do they have other funding sources? I'll just skip down, spoilers, to the North Front Range, the Ride No Co. one, the 300,000 spread over 2 years. We have found another funding source for that. So that 300,000 is cut from, there's 300,000 less we have to find because we're just saying 24 and 25 or wherever we have it, we're not using those funds. So if there's anyone that has that sort of an update or that can make that sort of callers have that discussion, then that's what we're going to go through. Otherwise, some of these have not gone, haven't either are not under contract or have not, have an IGA or partially, or I saw some were delayed, but others are completed, so we can't touch those obviously. So if there are any status updates that you have for your projects.
So would an anticipated year of expenditure be a helpful thing? So if you
Yes.
have money that is in this year, but you're not planning on spending it for 2 more years or something like that, that might be a helpful update if you want later years of funding. So for a project like that, I don't know what your anticipated construction date is or when you'd actually need the money, but.
Yeah, this one we need the money and we need it how it's been planned. So
I will say, that's probably the same for everyone who's on this list,
That's
so.
why I'm like, I don't know what to tell you. We definitely don't have another funding source.
And are you leveraging other funds with this money? Like, is this money being used
Yeah.
as a match to something else?
We have a lot of different funds going into this.
So this might be a match for some federal funds. I don't know what yours is.
I don't know.
Now the MMOF funds for the merge project are not matched. They have a CMAQ grant as well that the city is providing a match to out of their own local funds.
Thanks.
Okay, we can move on to the next project. I think we have a few here that are spent down. Or in prog. Okay, Windsor's completed.
287 sidewalk has been awarded and they're about to start construction. So, and that one will be a very quick, finished within weeks. So that one's going to be spent here very, very quickly.
Okay. Maybe the next one to discuss is Larimer County's Poudre River Trail.
Hi, everybody. Yep, Jen Olmsted with Larimer County. We do have a signed agreement and option letter, and the project is currently out to bid. And so we're expecting construction to begin later this summer. This grant is leveraging other sources, so we are relying on these funds to be able to complete the project.
And do you have an estimate of when the funds could be spent?
I believe within your current fiscal year, so by September, October of 25.
Hey, Medora, real quick. I think the projects that are highlighted are the ones that are a potential to be able to delay or cancel. I think all the
Yeah.
rest of them are above 26940 are all either out to construction, completed, or can't be delayed.
Okay, thanks, Bryce. Yeah, let's skip down. I do have this one highlighted, City of Loveland, US 34 Transit Sidewalk Connectivity Project. I know the IGA is in progress, but we get an update on that project.
That one was just recently awarded for 28, fiscal year 28, I think is the year that we anticipated funding for that one, or is it 27? So it's designed in 27, construction in 28. Very interested in continuing to keep this project. It's one that we could do it today if you, the design and we could start design today. So it's one that we could do earlier, or it could go later. We could push money out. We don't have other funds to fund this. So it'd be nice to get it in before we do extend transit service down that way. It's a pretty significant sidewalk gap along US 34 in Loveland, where there's a lot of pedestrians in this section, a lot of amenities in and around this area, and we have just a significant amount of pedestrian traffic and no sidewalk at all. So, but it is not started at all. We just are in the IGA process and we're expecting to start design or construction until 27.
Okay. And next, if we could talk about the Fort Collins Foothills Transit Station roundabout.
Yeah, this is Joshua Mall, the city of Fort Collins. We just got the IGA from CDOT, but we're expecting to start construction early next year, but that's
Okay, thank you.
That project also has other funds as well that we're not overseeing. So I don't know if that matters to anybody, but they do have, I think, FTA dollars as well that that project is contingent on.
Is this a match for the FTA?
It is.
It is, yeah.
Yeah.
So that,
It's a
We have
raise.
a $10 million raise grant associated with it.
if we get rid of this, you lose that too, which is a loss.
Okay. All right, for the next project, Lerma County's Taft Hill Road Corridor project, I have a note here about working on an IGA amendment and about to go to add.
Sure. We're partnering with Larimer County on that project. The IGA is fully executed.
Okay.
It's also included with this project. So it is ready to go to construction.
Okay, then we'll skip down to these next three. We already talked about Ride No Co and canceling that 300,000. So next one is these are new awards that were made. So transport en route battery electric bus chargers.
I think we're okay with delaying that project if needed to. We're still searching for the matching funds for that award. We're applying for 2 different grants right now, but yeah, I think we would be okay delaying if needed to.
Okay, thank you. We have this Weld County on-demand transit program with 567,000. Guessing that's VIA.
Yes, Evan, are you online?
We can't hear you if you're talking.
Okay, we can move on to the next one then. City of Greeley, 10th Street Transit. Oh, Evan, are you there? I thought I heard him.
Hey, sorry, I got disconnected. This is Evan Pinkham with Weld.
Thank you, Evan. Go ahead.
All right, so discussing our projects. So obviously we have some funds that are already operating that via mobility program. And then we were awarded those new funds that are outlined there. Do not have an IGA, obviously, with CDOT on that. We're kind of looking at what we're going to be doing in Upper Front Range as well, as far as those funds. So just some stuff up in the air on kind of how to move forward on the program in general and with these funds. Kind of just trying to figure out what the outcome of this meeting is and where to go from here. But you know, obviously we're kind of open to looking at that project and seeing how we can help out, trying to figure out with this funding reduction. So that's about all I have, but I'm happy to answer any questions.
Thanks, Evan. Let's talk about the City of Greeley, and then I figure if anyone has questions for anyone else, any of the sponsors who spoke, we could ask questions then. Victoria, do you have or there's someone there who can speak to that one? Thanks.
We're working through the agreement with CDOT on that, so we don't have that executed yet. I think if we needed to delay, we could potentially.
Okay, thank you. Yeah, any questions from the group on any of these project updates?
None in the room, anyone online?
So Medora, could you talk about next steps in this process and when CDOT wants to have this sort of figured out?
Yes. So we know this can take a substantial amount of work, especially for North Front Range MPO. Cutting down 2.2 million is not easy to do. We're looking to get the program reconstrained by October, if possible. So our thought is this could be just the initial conversation today about these projects. Project sponsors can then take this information back to your jurisdiction to talk through. Are there other options to fund your projects? Would you be open to reducing or canceling your award and contributing to getting North Front Range's program back into constraint? After that voluntary stage, it's possible you may want to go through and look at previous scores that were assigned to these projects during the selection process. Or if those are not a good source, maybe conduct a new scoring process to determine which of these projects are least aligned with your goals and put the reductions on those projects. So those are the main next steps.
So I do have a question. If we have other types of money, we've got some transportation alternative money that's going to fund something else, but this project that we have on here is a higher priority for us than the other project that we have. I know that's a messy question, but would there be a way if we get out of the MMOF pool and trade this out for the project that we have transportation alternative funding for, and it meets the, I would think it would score even better than the project that we have for TA if it were to compete with it today. So there's no question about, you know, what it, I think it would probably score higher. But would there be any option to, and then get out of the competition for this one by eliminating funding for another project we have in another type?
So we can't just swap them out. That's something FHWA frowns upon. They call it sub-allocation. We're not allowed to do that. What we could do is, and we've done this before, it's been a few years, but you complete an application from the same call that you're wanting to swap the funds for. It gets scored, we look at it, and last time that we did this, everyone agreed, TAC members agreed that yes, this should replace that project, and then it went to council. So, I mean, we'd have to go through the scope changes like we do, and then we have to do, you know, get council to approve this. So, but it's possible, yes. So, given what Medora said in the time frame, is there a path forward that TAC members would prefer? Would you prefer to go back to your communities to talk through different scenarios or solutions for those projects that can be moved around for, you know, so it's voluntary before we get to the not so voluntary piece? Because we do have to reduce. We don't have a choice. We have to reduce and come into compliance. So is that something that TAC members would like to go back, and then we can come back and talk about this next month? And side note to that, I don't plan to take this to council until there's agreement with the TAC members on what we want to take to them. So this will not go to council in July. So, but are there any thoughts?
I wonder if we don't bring back the prioritizations that we had for each of these calls to see sort of where these projects ranked. That might be an easy sort of data-driven way to say, okay, these are the projects that were the top priorities for each of the calls, and then maybe we can start looking between different calls and comparing projects. But I'm not hearing today a lot of, we may have to, I think it might be best next time to be prepared with some ways we could try to start that conversation.
Yeah. Anyone online have any thoughts? Medora, could you send this spreadsheet that you've been working in to me once you get it completed? That way I can use that as a starting point for the different calls and the rankings.
Sure thing.
Yeah.
Are there chances that projects that have been fully funded would be, or have been like constructed and reimbursed, would there be a chance that those projects would have to pay back? Just out of kind of.
I don't know. Medora, do you know?
We are doing everything we can to minimize impacts to existing projects that are spending down. As I said before, we're trying to spend down our balance and show impacts from the program. So only if the MPO wanted to take away funds from projects that are spending it down, you could make that choice, but it's not what we're recommending.
So you're recommending the highlighted ones that haven't.
And would there be, I think what Nicole was also asking is, would there be any chance that anyone would have to pay back funds that have already been reimbursed? Yeah.
Oh, no.
Okay.
So for projects that are maybe just starting, like I'm looking at the really active modes plan, it looks like it's kicking off in July of this year. Do you recommend we just keep full bore moving through new projects like that and spending where we can and getting them spent down? Or do we want to pause on spending until we have an answer? I just want to make sure nobody's left holding a project. Money.
Yes, that's another choice that you all can make. What we've been encouraging is for projects to keep moving forward to spend down the fund balance. But if there are projects that are about to spend dollars or about to go under agreement where North Range might want to reduce or cancel that award, and you want to pause those actions, that would be your purview to do that.
I hope we don't.
Okay.
I have kind of a historical question regarding fiscal year 21. Noting it wasn't in this year, it goes fiscal year 20, and then right to fiscal year 22 ARPA. Was that not a year where NMOF was funded?
Yeah, the history of the program had different phases. So it was originally launched in, I think, maybe 2018 or 2019 as a one-time fund. And then with Senate Bill 21, it got funds from ARPA and an ongoing state funding source. So it's drawn from a few different sources over time. And there was no specific fiscal year 21 for the program.
Thank you.
Any other questions from Nord? We'll move on to the next item. Thank you, Medora, for that.
That's all.
Just ahead of our next conversation, we'll be prepared next time.
We'll not do another work session or how is it?
Do another work session. I didn't think we'd be done.
Well, I think we can start to say, we think these are good. Yeah, I'm comfortable having a conversation today. So if we want, I don't know if people need time to process or if we want to start having conversations about ones
that. Is anyone prepared or ready to speak to that, or do you want to go? I think we're going to go back.
I need to get back.
Okay. And then I can come next month with the scoring for those projects, the different halls, so. For the ones that are eligible.
What makes the other ones not eligible?
They're completed or they're ARPA funded. So that's federal ones.
Those are all the great ones.
Yeah. A lot of the grant ones are either done or under contract, have an IGA, under construction, or they are ARPA funds. So that's.
they have an IGA, so they don't necessarily.
If we have an IGA, well, we have an IGA for a tax law project.
We do
so
for
how
the
is that?
34 sidewalk.
Yeah, I'm not sure that's what I heard from CDOT.
Well, that's because they were they're in the years that have been targeted, that are, the rescissions are coming from. So project 23, 24, 25. So if you had funds in those, that's what they were looking at. And those could be pushed out to the out years as well. Those could happen. She's still on, so.
Yeah, I'll just jump in and while the guidance is to, if we can, not remove funds from a project that has an IGA, the sort of the hard line we're looking at is not removing funds from a project that has an encumbrance with an option letter. So we really want to avoid that. But if there's a project that has an IGA but doesn't have an encumbrance yet, those could be still on the table. They're not as great to be amending compared to a project that is not even at the IGA stage. But it's still within our guidance that could be a project that would get reduced or removed funding. Does that help? In some of these cases, since a lot of projects are under IGA, you would need to start removing funds from those projects.
Is there a way to have the table updated to include funding that has not been optioned yet? Because, and also have the phase that the project's in. Because there could be some that are almost about to finish design. Others that, maybe they're 35% through design and haven't hit construction yet. Others might be right on the verge of pulling the trigger on construction. So I think it helps in the conversation.
And also just the readiness, what, how can we get started, which projects are ready to move forward today.
One question I have for Becky is if the spreadsheet you received from Michael has a third tab of project info. Do you recall if that was in the spreadsheet?
It is.
Yes.
Okay. So that tab does have more information about what is encumbered and the expected phasing for the projects. So that can be a really helpful resource. It's a lot of information in that tab. It's a lot of columns, but I think that will have the information you're looking for.
Majority, does it have that or one of these columns have the optioned amount?
Yes, the optioned amount is the encumbrance amount. So when you are looking here, here's a version of that tab. So it shows it by phase, and it shows the state funds that are currently encumbered. So you can look by phase and see what's encumbered. And I believe it's also totaled at the end about what is encumbered. So column CN has the state funds that are encumbered in an option letter.
I need to look at the totals of the project, but one of the thoughts I had in the transportation alternatives called we won the Garfield project, but TAC was also in that called the projects, if I remember, is the second scoring one. I don't know what the amounts are, but if you're ready to spend that now, if that's something that you could get money aligned with when you're going to deliver, and we could give up our Garfield one, that one's less of a priority for us than the later year 34 project that we have. I don't know if that's an option. It was one of the calls in the call for projects. So if we
go back and look.
Yeah, it might be worth looking to see if there's a way to get you the money you need in the year you need it, and it's a concession we can make that doesn't affect us as much as the other. We have TA funding for Garfield. Do you remember the amount?
Yeah, it was like $900,000. But with TA funding in that call, it wasn't the TAC project, it was the Mason Trail improvements project. The TAC was just zero funds.
Okay, never mind, sorry. Trying to think of clever ways we could.
But if there are things like that, that is a good thing to think about. So, maybe that's a good sort of homework thing to think about when you go back if there's ways to do that.
I'm just trying to think through the accounting on this. How are we balancing the budget for 2023 using 2026 dollars?
So we are about to enter into fiscal year 2026, starting July 1st, 2025. And with the cash management approach we're taking on to help bring down our balance of unspent funds, that's where we're allowing projects that have 27 or 28 funds to access those funds now. So that is how we're saying projects that were awarded those previous year funds can be pushed out in a way to 26 and beyond, but still access those funds now to the extent that we have those funds available. Does that help address the question, or did I mishear it?
Is that what your process is trying to get projects organized where they're funding for the actual year of expenditure. So if there are projects that you have with earlier years of funding that need to be delayed, let's get those organized to the later years. Projects that are ready to go now so they can spend down the cash balance can go sooner. Is that sort of your thinking, Medora? Is that we get projects sort of in the right year, so we aren't holding on to money to get through all the clearances and everything you have to do, but you're getting those projects organized in the right years of spending.
Yes, thank you for stating that.
Years, projects that might not be ready. So if you have a clearance or right of acquisition or those sorts of things, move those out to later years. And then projects that can go today, let's get the money spent down.
Mm-hmm.
And I guess looking at the numbers here, I don't know if this will be the situation, but what happens if more money has already been spent for 2023 than what's available?
Sounds like they've got money in the bank.
Yes. Across the state, we have a balance still in our MMF program, which is why we're allowing projects to advance. A lot of projects have clearances they need to get through, a lot of pre-work before the spending can occur.
And bigger picture, I guess, looking forward, they saw this as money that hasn't been spent, but is there a way to educate them on the process of these projects? Because it takes time to do these projects, and it's not that we're just not spending the money, it's we're going through the process.
It's a really good point and something we have tried to emphasize with the legislature. We even asked for continuous spending authority this legislative session, which is totally the opposite of what we ended up with. Right now, this program, we have to ask each year for spending authority on the funds they've already allocated to the program, which makes it really difficult to plan ahead. So we don't have continuous spending authority at this point. Our goal really is to spend down the existing balance and keep the program as intact as possible with the funding that's been allocated.
Is another option for reducing the allocations to look at the unoptioned funding across the board and reduce it by the percentage that the reduction needs to happen based on that total amount?
Is another way of saying that reducing certain phases for projects?
No, it's looking at all of the unoptioned funding. So say that's 8 million. And we need to reduce by 2.2 million. So that's a percentage of 8, and just taking that out of everyone's award, of all of the awards.
I feel like that would be more equitable.
I would encourage you, if that's an approach you want to take, to make sure that project sponsors think that they could still proceed with their project, because that was one of the pieces of guidance we provided out, is that we discourage partial funding, because oftentimes this leaves projects sort of hanging out there as they try and reassemble their funding package and makes it take longer to spend the awarded funds. But if that is not the case, if projects are still able to go forward with that partial award, that would be a more equitable approach. Just carefully consider what that means for your projects and their implementation.
And maybe that's something to look at after we've been able to go back to our individual or bodies and discuss if the projects can remain viable.
It might be worthwhile too for each of us to think about if we had to lose one thing on this list. You may only have one, so it's for some communities that's not a fun conversation. But for those of us that have more than one, what would you offer up first, right? If you had to lose something, so I think that would be a worthwhile exercise. Just think about sort of what you could lose, what it means to your community, and that it's hard for me to think about too, but worthwhile to come back with some ideas of how we could cut back.
I think the approach of like, looking at reductions and making it more equitable makes sense. I wonder if we can, it's not a fun situation for anyone, I understand that. So asking ourselves the questions about, which projects can we absolutely not risk, and then which ones could we work with a partial or lower funding? What would that mean? I don't know, is it, do we want local agencies to come up with those projects? Or
I think it's just a good internal thing to prepare ourselves with next time, is if you had to lose them, really has a lot of projects on that list, right? And what would you pick of the ones you have? Would you reduce some of the big ones that you have, or would you pick, ones that are just starting, but maybe you haven't spent the money yet? So those are some, and similar for level, we haven't started the design for the 34 sidewalk. Super important to us. We could give away funding in other categories maybe to keep that one on the list, but the transit service for us, it's one of the grayed out ones. Super critical. That's mission critical for us, so we can't lose that one. So we have to look at the sidewalk one, right, instead of that one. Keep that. So I think those are the kinds of internal questions we should be asking ourselves before we come back. So we can get to a reasonable solution that is tenable for us. Any other thoughts or questions?
I have a question. I was just wondering what the timeline of like the next federal call was.
Well, it was supposed to be this year, but given everything that's happening, I don't know. That's too bad. So unfortunately, I don't know. And at the statewide NPO meeting last week, we found out that we have reductions from for our funding in the federal funding, as well as the funding we get to do the work that we do from 26 to 29. So I don't know. So we're going to come back again with an even more fun conversation to talk about the federal funding sources that we've awarded that now have reductions. So,
Oh no.
yes.
So then there's not going to be any option for
Trying to backfill.
funding.
Yeah.
And I will say for us, it's in the thousands. So we're not talking hundreds of thousands in reduction. We're talking like 50,000 reductions. So we're going to have to take some funds from somewhere, but it's not going to be quite like this. So, but yeah. Sorry.
I do have to.
It's getting better.
Yeah. Thanks everyone for the conversation today. I do have to hop for another meeting, but feel free to reach out if you have questions, and then we'll be back to help support in July.
Thank you, Nora. Thanks so much.
Thanks.
All right, deep breath.
So, yes, so I will, and whatever she provides, I will go through and I will get the scoring, as well as the updated spreadsheet, and I will send that out. So, he will not be on until, he's not going to be on until the scheduled time, until 2 o'clock. Okay. Brendan will not be here. He is on his way, traveling with the AQCC and staff to their retreat. He did provide me with some AQCC updates if anyone is interested, but I would prefer to him to speak about what they're going to talk about at the retreat today and tomorrow. So Yes, and
Tom
Tom
is
is,
just joining us, he's still getting his audio.
so we don't have anything for that. But then I sent you an email with Tom's slides, sorry.
Oh, yes. Yes, let me pull them up.
Welcome, Tom. We are running a little bit ahead of schedule, so we're just getting your slides pulled up.
You're gonna drive. Can you hear me okay?
We can. We're gonna share this presentation here.
All right, let's pull up.
Yeah. I'm gonna go to the slide.
Okay, great. Looks good from my end. Are you guys ready for me to start?
Yes, Tom, thanks.
Okay, great. Thank you. Well, good afternoon, everybody. Tom Moore with the Regional Air Quality Council here. As usual, I'm going to check in with a few slides on kind of upcoming activities that we have going, and ask you all to, think beyond your duties and your responsibilities, and think about whom in your agencies or your organizations, might benefit from attending this blueprint effort that we're going to work on. So let's go to the next slide. We need to there we go. So clean air that focuses on air pollution control strategies, for the non-attainment area that includes, of course, Larimer and Weld County jurisdictions. We've done this before. This was called the Blueprint for Clean Air. It was more than 20 years ago now, but it was a public process to lay out recommendations for future steps to reduce emissions and move towards cleaner air to reach the air quality standards. And then that culminates in a report that we hope to complete basically by about November 1st of this year. So we're on a short fuse, I guess you might say, but I just want to walk you all through kind of our plans for that, and then encourage you or your colleagues to be involved. So on the next slide, what do I mean when I say a blueprint? So we want to look at control strategies and emission reductions that can be put into place over the next 5 years. We're not writing regulations or defining exactly, what the change would be, but we're trying to compare and contrast different options. Not all of these would necessarily ever be a regulation. They might be voluntary or incentive-based programs, but we're trying to take a strategic approach. As many of you know, the Air Pollution Control Division decided to postpone action on trying to reach the ozone air quality standards. And so we have a longer time frame to take a more strategic approach, but we're interested in making steady progress over the next 5 years so that we can have cleaner air starting to be measured in the 2030 through 32 timeframe that's shown there. So we have kind of, 3 types of strategies that we hope to talk about, kind of those that are already adopted and are on the shelf, and we could just pull them down and, have them go into place. We've gone through quite a process, some of which I've shared with you all, about, analyzing new strategies over the past 8 or 9 months. So we're going to look at those again as kind of a batch of strategies. And then there's a lot of strategies that the division, Air Pollution Control Division, and the Air Pollution Control Commission have already adopted and we need to look at the effect of those strategies as they come into place by 2030. So there's kind of a longer time frame. But we need to have the Air Pollution Control Commission and the Air Pollution Control Division, decide what actions to take, because we need to have lower emissions before this measurement and modeling period of 30 through 32, which is the goal for under the federal standards. So, lower ozone, achieve those emission reductions, have a plan that complies with federal standards. Those are the general goals here. Then on the next slide, we're going to take the strategies that I mentioned and kind of group them into what we call buckets. So we're going to use this approach in developing our blueprint. This is what we're going to ask our board to consider, and then ultimately carry these buckets to the Air Quality Control Commission. We want to present these 3 buckets of strategies that we're organizing based on all available information. We also have some tools to evaluate the ozone change that would result from implementing or adopting individual control programs, or combinations of all the strategies in the buckets. Generally, we see that individual strategies, just like an individual transportation project, doesn't necessarily change the region. So we want to look at combinations that would be effective and what timeframes they would be effective over. So these 3 bucket bullets down below are, kind of the off-the-shelf idea. We're going to propose that the commission consider those in 2026 and then start requiring their application in the 2027 ozone season, so we can start practicing this really seasonal approach to controls. The second bucket is some combination of annual, meaning year-round, or ozone season strategies. We've gone over a lot of those with our board. There's been a lot of work previously on looking at what strategies might be available, but we want to make a specific analyzed list for the Air Quality Control Commission to consider implementing starting as soon as next year. So that's kind of a complementary bucket. And then the third bucket you might think of as, here's what will happen if we don't do anything else, because there's a lot of rules on the books already that are designed to reduce emissions out over a longer time period, out through 2030. And so we're able to analyze those and say, by the time those all come into place in 2030, how does that affect the ozone that we're already seeing? So that's the idea. They're kind of overlapping and complementary buckets of control strategies. Then on the next slide, here's a short-term timeline with symbols and descriptions of what we hope to accomplish over the next 5 months. So we've given generally this overview at a recent Control Strategy Committee meeting, and then later this week we're going to be releasing a first version of this, a detailed outline of the blueprint. Then we'll continue with our processes through the Control Strategy Committee and our indirect source work group, review and discuss those. We're going to hold a couple of day-long public workshops. Everyone's welcome. July 22nd at Dr. Cog in downtown Denver. And then we've scheduled August 18th as the date, location to be determined, but we will hold the August 18th workshop in Fort Collins. And then in the September timeframe, we'll come back together with a final draft of the blueprint plan. And then at our October board meeting, we'll be seeking their endorsement. Assuming they endorse the blueprint, we'll carry it forward to the Air Quality Control Commission in November, as the timeline shows. So we're going to be quite busy, and we'll be very public about this, and be having a lot of materials posted on our website, and a lot of reaching out to people to ask them to engage on this. On the next slide, so I want to turn my attention to you all, the TAC North Front Range TAC specifically, this is really what we hope to achieve with the workshop in Fort Collins in August. We want to involve air quality and transportation planning staff from the cities and counties that comprise the North Front Range region. So this is an opportunity to contact colleagues, share this information, which I appreciate the North Front Range NPO staff, sending this out. And we're seeking involvement from all the cities and counties in the region. So that's what I'm going to talk about in a couple of slides now. On the next slide is a description of the logistics of these workshops. So I've made the Fort Collins workshop, bigger to draw your attention to that. It's going to be on the 18th. We're thinking of a 6-hour workshop. It's open to anyone who registers. We'll get the location confirmed. You can go ahead and sign up to either participate in person, or there will be a listen-in option to attend virtually. And of course, we'll be recording, summarizing what we hear at the discussions at the workshop, and documenting all that. If you register, or if your colleagues of yours register, we can use that registration list to share additional information about the timing and location details. And we all have to eat, so we're going to serve lunch at both workshops, Denver and Fort Collins. So that hopefully that'll be a lower bar and keep people in the room while we are holding the workshop. On the next slide is a really kind of generic description of what we're going to do at both workshops. So this is similar for both workshops. We're, of course, going to welcome and introduce things, kind of frame it with a local introduction. We're going to have some what we call foundational background presentations that will involve, Q&A if they're interested. So the RAC will do one. We've invited the local MPO leadership to give their vision of air quality and transportation planning. So I think that'll be the case in North Front Range. And then we've also invited the Air Pollution Control Division to talk about, what they have going on right now and where that will take them over the next few years. Then we'll probably take a lunch break in terms of breaking this into 2 parts, and then we'll spend the afternoon working on the blueprint. So we'll talk about those buckets of strategies with kind of explaining in a little more detail what information we have, and answering questions and getting review and comment from the workshop participants. We'll talk about how we will evaluate, what methods we'll use to evaluate those changes in emissions, the air quality benefits, costs, and then, all things are possible probably with enough time. So we also want to examine the options for the timelines to have these rules and programs in place, and with the out year of trying to have effectively reduced emissions sufficiently by 2030. And then we'll, wrap things up. So that's about a 6-hour long workshop, kind of generic agenda. We'll obviously have more specific agenda with names and topics. So that's it on the control strategy workshop stuff, and I'll just do a couple more slides, and then maybe if people have questions, I'll be glad to try and help them. So on the next slide, I'm going to turn our attention to, we've been doing these kind of roughly quarterly ozone forums where we talk about what our analysis is showing. And so we have a kind of a major one coming up on July 25th. If we go to the next slide and last slide, it's Friday morning from noon to 12. It's virtual. These are all virtual, so we can record and summarize the meetings and post that information afterwards. So there's a number of substantial agenda topics. There's been a lot of changes to the planning approach with this blueprint and the decision by the Air Pollution Division to kind of slow down on trying to reach the federal standards. We want to make sure people are really clear on what the the Sirius 2026 modeling results that we completed a couple of months ago, what those are showing. We're going to have updated source apportionment results. And source apportionment is the source categories that contribute to the projected air quality in 2026. So that allows us to look forward and say, okay, what proportionally do different source types, on-road mobile, non-road activities, lawn and garden, oil and gas, a wide variety of different source categories. What do they contribute to the modeled ozone that's estimated for 2026? We have a new method that's listed in that fourth bullet. It's called the decoupled direct method. It's a method that allows us to actually look at the different settings for NOx and VOC emissions and change those by applying the effects of control strategies so that we can see how much the ozone will change. So it's a pretty cool modeling technique that we can then use to scale the results. So we'll describe how that method works and talk about how we plan to apply it. And then, as we've done in the past, we'll make reports and dashboards, particularly with the source apportionment data available so that folks can, interpret and use that information for their purposes. So this is another registration activity. So if you'd like to attend this, there's the registration to get signed up for that. So thanks for letting me go through that stuff. Be happy to try and field any questions.
Any questions for Tom? Thank you so much, Tom.
You're welcome.
Okay, and then Brendan is not here today, so we're going to skip down to our first discussion item, which is the 2025 Coordinated Public Transit Human Services Transportation Plan. Hand it over to Aaron.
Thank you, Joel. Awesome. Hello guys, my name is Aaron Pohl. I usually come in virtually, so this is the first time for a few of you guys meeting me in person. But I'll be talking about the 2025 Coordinated Plan, and I'm also the mobility planner for our mobility team. So I'm just going to do a quick presentation overview mobility and what we do, as well as our Ride No-Co program, since I don't know the last time that was talked about to you guys, as well as just go over what the coordinated plan. I'm just introducing the coordinated plan to you guys. I'll be bringing it to Planning Council come November for adoption, and I'll bring it back to you guys either December or January to talk about what was adopted. But this is just to introduce what we're going to be doing this year. So to highlight what we do on the mobility team, so for mobility, we focus specifically on transportation for older adults, individuals with disabilities, and then just any other underserved community that we can support. Some of the mobility programs that we do have is the Ride No-Co One Call, One Click Center, something that mobility has been working on over the last 5 years, but something we do currently now as a full program. It's basically an information hub on a website as well as a call center. We're also working on bringing up My Way to Go, which is a trip planning platform that is used in the Dr. Cog region, but we are bringing it up here to expand to our region. We also run the mobility committees for the MPO, so that's a Larimer County, a Weld County, and a joint one, and all three of those run quarterly. We also do sub-recipient programming and technical assistance, so that's helping different partners like 60 Plus, Saint, via RAF, just to name a few, help with getting federal funding or state funding, and then with service expansions. We also do a lot of community outreach, education, engagement, so that's going to different farmers markets or festival days to talk about transportation and get those resources out there, and as well as talking to different groups like UC Health or different clinics to talk about transportation so that they know the options when they're helping people. Then we do planning efforts, which is what I primarily do. So that's the 2025 Coordinated Public Transit Human Services Transportation Plan. I just call it the 2025 Coordinated Plan because that's really long to say. We also do the mobility action plan, which helps guide that. We also work with multi-partners, so that's working with DRCOG or Boulder or other agencies outside of our region to help with strategizing multi-partner coordination, as well as just different planning processes that I can support. To highlight what Ride NoCo is about, because that is our main program, it embodies two different overarching goals. One is improving individual mobility for these different groups I've been mentioning, so older adults, disabled individuals, lower income individuals, and just any underserved community. We also support improving regional mobility through coordination and collaboration among regional and public transportation providers. So that could be the nonprofits, the volunteer, or the different public transits we have up here. To show what we have, our Ride NoCo website is up there. So right now it's just an information, or it is an information hub that provides all transportation resources in one area. So if individuals have questions about transportation, we just direct them to that website and they're able to break it down also based on what type of transportation they need. So if it's transportation for older adults, wheelchair accessibility, veterans, cancer patients, the list goes on. We have it broken down into different categories of transportation. We also have a mobile friendly and an ADA compliant website. So it's low vision, hard hearing, low visual. We have that type of website. It's the little symbol on the top of it. We also have a trip discovery tool that had been worked on for the last couple of years that allows you, it's kind of like Google Maps, but a little fancier because it lets you select different forms of transportation as well, and it'll give you the different routes to use them in the best ways as well. We also have a call center that's ran Monday through Friday, 8 a.m. to 5 p.m. If we miss a call, we call back within 1 business day, and we can take over 100 languages. I think last time I looked at Language Link, they have 300 different languages that can be translated into. And then if you call, you get Lisa, a mobility specialist, and sometimes me if she's not available. To kind of highlight the call center and website, we've received so far 159 calls this year and 3,042 website visits. It's been increasing every year since the start of the program in 2021. A cool thing about the call center and website visits is we collect a lot of data from those calls because we ask people, are you over 60? Are you a veteran? Different questions to kind of find them the transportation resources that best fit their needs. But that also allows us to collect that data and put it into fun heat maps or pie charts. So this heat map on the right shows where most of our calls and website visits come from. So it highlights where a lot of those people that have questions about transportation. A lot of times we find those are just the areas that, if you know that part of the region are lacking in transportation or in transit, so like the northern Fort Collins North College Avenue area where there's only a few fixed routes. So you'll see where those little bubbles are is typically where transportation needs are. And then some of the pie charts that we get from those questions we asked are highlighted there. So we can look at the counties, how many of our calls come from which county, how many calls are over 60, what the trip purposes are. So about 50% of our trip purpose calls are for medical reasons. Then after that is miscellaneous, so going for social events, people who just want to get out of their house and not be isolated. And then after that is employment and grocery stores. And then we also are able to look at the gaps in services. So when people call, we can figure out what gaps are in transportation that they are missing. The number one we look at outside of multiple reasons is last minute calls. So people that are calling the day of a doctor's appointment, an hour before a doctor's appointment. And that's harder to figure out just because a lot of the times for paratransit services, you have to schedule in advance. If you're not already into their services, you can't really schedule in advance as well. So that's just highlighting Ride NoCo and what we do on the mobility. But the coordinated plan is what I'm here to introduce to you guys and just get some discussion with you. So the coordinated plan is updated every 4 years. It's the strategic plan for mobility in the region. It specifically looks at mobility for older adults, individuals with disabilities, and low-income individuals, but we also look at underserved communities that we can support as well. It helps set up project priorities for the next 5 to 10 years for mobility, as well as these projects can be funded through 5310 funds. So stuff that are written into these coordinated plans can get funding. An example of a project that gets 5310 funds that are written into this coordinated plan is Ride NoCo. So if you look back at 2021, you'll see that Ride NoCo is written into that plan. The plan is broken down into 4 parts. First part being analyzing existing conditions and options. Second part, evaluating social, economic, and ridership data. And then third, we look at the gaps. And then last, we strategize improvements for these gaps. So kind of highlight some of the demographics that we look at. We look at the older adult populations. That's one of the main demographics we look at. So right now in 2023, the NPO has about 549,000 individuals within our region, and about 91,000 of those individuals is 16 above, which is about 16.5% of our population. Our models show by 2045 that the NPO region should jump to around 900,000 individuals, with a total 16 above population of 160,000, and that will make up about 18% of the total population. Another trend that's not written into this slide, but something that's kind of discussed when we go to mobility, and talk to other regions, is that Colorado's in the top 5 for aging populations. So we're one of the fastest, or not fastest aging, but one of the biggest states for aging populations over the next couple of years. And then we look at also individuals with disabilities. So the NPO's region has about a total of 473,000 individuals non-institutionalized, and the percent of that non-institutionalized population is 11%. 1% of the 11% for individuals with disabilities under 18. 6% of the 11% is 18 to 64, and then 4% of that 11% is 65 and older individuals. We also break it down by counties, but it looks at the overall counties, not what's in the NPO's region. And then these gaps in services. So the gaps in services on the right is the pie chart we get from our call sheet and the call data we get. So that highlights all the the reasons we hear from individuals calling into us. But the ones on the left are what I've been hearing from the presentations I've been giving. So I've been going to the different disability advisory boards, senior advisory boards, any kind of advisory board who wants to hear me talk, as well as going to different stakeholders like UC Health and other clinics to talk about the coordinated plan, get some feedback from them on what they hear for transportation. And the ones on the left are what I've been hearing commonly. So that's a lot of the new neighborhoods that are being developed in our region just doesn't have transit yet, as well as getting in between the communities. So if you look on the right on those gaps, you'll see we get about 5% of our calls from in between Loveland to Fort Collins, or Fort Collins to Loveland, where there's no transit services that run in between, only the MAX line, and there's not a stop in the unincorporated area. So getting in between communities can be rough, especially for a lot of individuals who are older or disabled. As well as our rural areas need more support. So we get a lot of phone calls from areas that are more rural. We get a lot of calls from Wellington, Red Feather, Severance, a lot of those more rural towns compared to Fort Collins, Loveland, and Greeley, where they need more support with their transportation. As well as we've been hearing a lot from health clinics about temporary disabled individuals. So it's a big issue that UC Health and Kaiser and Banner are dealing with, is individuals who have to go to a doctor's appointment for sedation or anesthesia, and when they get out, they're kind of semi-conscious, and a lot of times they can't get rides because ride services don't want to provide it due to liability. As well as that can incorporate individuals who say break their leg and for the next 6 months they need to figure out how to get to work. They don't have a car, they can't drive. So how do we support those individuals that are just temporarily disabled for a day or a couple months? And then all of those kind of tie into the next one, which is affordable transportation. Because if they can't use, their own car, or if they can't use transit to get around, they're stuck using Uber or Lyft a lot of times. And Uber and Lyft can surcharge price depending on if it's snowing, raining, busy event, whatever reason Uber feels like it, they can surcharge pricing. As well as a lot of the service providers talk about how they would love to expand their services. Saint would love to cover all of Loveland and Fort Collins, but their funding is limited, so they're only limited to what their funding allows. And then lastly, we hear a lot about awareness and outreach because we have a lot of resources already in our community. It's just a lot of them might not be known to the whole community. So just getting those information out there, like the tabling we already do, is important. Then some of the ideas and strategies and projects that we've been suggested. So, when I do this discussion, I always ask what some ideas, strategies, or projects that we could look into because, as mobility, we've really focused on Ride NoCo over the last 5 years since the last coordinated plan, and it's up and running now. We're working on it, and we're trying to see how we can expand it and optimize it. But what other projects can we focus on as the mobility team to kind of help with mobility in these gaps? So a few of the ones we've heard is like the volunteer pool. So this idea came from a lot of the volunteer driver programs because they have an issue finding volunteers, as well as we hear a lot from the community that a lot of individuals just want to help their neighbors, help get people around, maybe for a few hours on a Tuesday or a few hours this day, but they don't want to sign up and go through the process of, working with SANE or working with VIA or working with 60 plus. So an idea that came from the Aspen Club is, why not create a centralized location for individuals to volunteer where people can reach out to those volunteers for rides, for doctor's appointments, or for other reasons. Another idea that we were suggested was a medical chaperone program. So running a volunteer medical chaperone program that could help with individuals who need to go to doctor's appointments or who are temporarily disabled, as well as creating an emergency fund that we can use for trip vouchers for like Uber or Lyft for individuals. So when they call on the Ride NoCo, if there's no services at all that can help them, we can at least help them with a voucher. Another one we were suggested is a Earn a Bike workshop for adaptive bikes. So helping to get more adaptive bikes out to older adults and individuals with disabilities, and as well as training those individuals on how to use adaptive bikes. And then lastly, expanding our Ride NoCo. So that can include tying in more people to our ride scheduling system, as well as creating an app for Ride NoCo or creating a more extensive physical guide that we can give out to individuals that gives a lot more information, because a lot of times we hear from the older adults and individuals with disabilities, they love we have this website and call center, but they would love for a really nice paper guide to use in person. And then I have a public survey running right now. It's up on our website as well as a QR code. I give public surveys as much as I can out to, or public survey flyers to every board and whenever I table to try to get as much response as we can. And then lastly, that's just leading to just these discussion questions I have for you. So answer any questions you guys have about what we do on mobility, or answer any questions about the plan, and then just kind of get feedback on maybe mobility gaps that you guys have heard of in your community that I didn't highlight, or any other suggestions, or if you have comments on those suggestions that I've heard about. Yeah, that's kind of it.
Any questions for Aaron?
What was the timing on the plan too, like when you guys were trying to wrap it up?
Yeah, so we'll have it, we'll bring it up to Planning Council in November for the first reading and discussion with them, and then December for final adoption. And I'll bring it back either December or January to you guys. I guess depends on the holiday season calendar.
Probably December.
When would you like, like those questions answered from?
You can, if you have suggestions now, or if you just want to email me after this meeting, I have my contact information on the slide deck, so you guys can just reach out to me with any comments.
There's some, we just have staff that I would rather get their answer as opposed to.
No, that's totally fine.
And this presentation was in the packet, but it's in the last week, nothing else.
Go back to them.
Yeah.
I would just say, I think for, I think there's maybe, people would be surprised to know about how many, like, our aging population, and just thinking in terms of like equity, equitable streets, right, for mobility, and at some point, all of us aren't going to be able to drive. And I think that's just something we don't always think about at my organization. I mean, my team, we think about it a lot, working in transportation, but I think a lot of like our other departments might not be aware of that. So I think just more education around it.
Certainly something I've become more keenly aware of here in London, just a different population that we're serving here in Fort Collins, and it's something that's is super important. We do a lot of outreach with some of our different groups here in London, and that's been one that it just affects so many of our population here.
Mm-hmm. Yeah, I think for us, a lot of, we sometimes run into pushback from the development community around some of our, like what we want to advance the mobility side, and I think, just, like, I think we all in the room understand, but it can be challenging to, like, especially if you think about mobility in terms of other priorities like affordable housing, we often feel like our developer community is like, oh, well, we need to make this project affordable, so we need to, dedicate less space for sidewalks and things like that. And it's like,
the people that need it the most get the least amount of those.
Right. So
It needs to be affordable, and you need to be able to get to it affordably.
exactly. Like for us, we're like, it's one and the same. Like, you can have the most affordable housing, but if your transportation costs are incredibly high because of the location, then what do you get, So I think I just appreciate I hope that, for anyone who has suggestions or ideas on how to help educate or raise awareness around that, I think there's also just a lot more folks that don't, there's a whole number of reasons why you don't drive, right? And we don't always think about that, or at least some of our development community, I would say.
And I think that's a conversation that we've been having a lot, because something that we've been working on is a lot of outreach and engagement with our community partners. And, transportation and mobility, our funding is going in a different direction. We're working on children or household stability. And I always take it full circle and say, regardless of what pillar you're working on, transportation and mobility has to have a seat at the table. Because you're never going to have household stability if you don't have transportation and mobility to get that individual to work. You're never going to have, childhood development if you can't get that child to school. So if you really want to have healthy and successful communities, you have to have access to transportation. And, whether it's having sidewalks to get where you need to go, or, mobility. So I think just having your voice at the table, regardless of what the pillar is, if you want healthy communities, you just have to continue to raise your voice.
Yeah, and it's like, I think we often think of these things as competing, right? Like, you can either have the affordable housing or you can have, a great mobility network. Like, you have to choose, and I think it's like, we are trying to really shift the understanding to be more like, yeah, to your point, they're so intertwined, they're so directly support each other, or don't support each other, so, yeah.
So to continue to voice your opinions, retrain the brain sometimes, they go hand in hand if we really want successful communities.
Yeah.
To your point, it might be helpful to have, ideas or projects or outcomes of this could be policy work about how we get that. The hard part about transit and developers is they are there for the one-time cost, and transit cost is really the owner and the ongoing cost. So you might need transit service, but that really is an ongoing. So what are models? I know CEF models in both Loveland and Fort Collins are set up for sort of this, we pay back for roads and that's it. But are there, and I know Fort Collins is working on a lot of policy work to maybe shift some of that to pay for some of these other things, or to include reimbursements for, trails and sidewalks and those sorts of things.
And transit.
Yeah, and transit beyond what the original piece was. But the hard part for that is just that ongoing cost of transit. So that model is just a real challenge. So having an outcome of this be, you know, future policy work, because we're all probably facing the same problems in all of our different communities, and having some roundtables or conversations about what's working for some to help bring ideas, so.
I would love that.
Just kind of a general question, given the funding discussion earlier, is 5310 funds, are those kind of unstable right now? Do we know anything about the projection on that? Or is it still, is it more or less secure than other funding types?
As far as I know, 5310 is stable. There's, the apportionments come out, there's sort of, so FY25 just came out, so they're kind of not lagging, but they're a little behind, so they're more, I would say they're more stable. We haven't seen reductions. Like we've seen in the other stability funds. But they are based on population, so if the population changes, then it can go the other ways.
Thank you.
Any other comments? Anyone else want to answer this question? Did you get what you needed?
Yeah. And like I said, if you want to follow up with me afterwards, or if there's someone better at your organization that could have a deeper conversation about this, and send my way as well.
Thank you. All right, and we'll move on to the tenure prioritization this morning.
So I just wanted to talk about the projects that we will be discussing in the workshop, work session, whatever I called it, on Monday. So all of the projects that we've discussed before are shown on here, plus 3 that were on Tier 2, which was the request from Planning Council at their meeting a couple weeks ago. Everything that's on Tier 2, bring that along with the projects we already talked about. And there were only 3 projects that were on Tier 2 that we hadn't already pulled onto this list. So that's what the orange projects are. So it's 134 project, and then the Spaghetti Junction at the bottom there, and then US 85. I can't read that from here. So I just know it's US 85. So what's hidden on here, so I pulled out the corridor planning study, so those 2 are at the top by themselves. I don't remember who suggested that, but I did pull that out. If you scroll down just a little bit, the projects are grouped by corridor and are either east to west or north to south, depending on the orientation of the corridor. So there is no ranking at all other than where they fall on the map. So, this is what we'll be talking about on Monday. I have received, during this meeting, I received from CDOT the same information that we had for all of the other projects, for these 3 projects, and I will be putting that into a spreadsheet. I'm going to send stuff out tomorrow. So I'll send an agenda as well as an updated Excel spreadsheet. So, if there's any questions, happy to take them. Otherwise, I'll send it out tomorrow.
Are these in any particular order, or are these in order they were ranked?
No, these are in order from north to south or east to west.
Oh, just in there.
Yeah.
Within the order.
Yeah. So no ranking.
What is the format going to be? Is it going to be more thought exercises?
No, it's going to be more like the TAC workshop was, where we had the scoring workshop to talk through the projects. I don't know how much I need to bring out the scoring criteria. I'm going to have it there. I'm going to do these 3 projects as to the best of that I can. In that spreadsheet with scoring. And then, I don't know, I'll be honest with you, I don't know, because we did a data-driven approach and we had the rankings. And so I don't know what else we're going to do.
Consider 1, 2, 3, know, just as a way to, you can have people submit, then you can have all the rankings, and then it's then done, you know?
What's hard too is, I don't know if everybody for sure can be there, if there can be a representative from each community, but we really, I think I would say in the last, we felt some of the communities that weren't there, right? Like, I don't, I think the dot exercises and some of those are, that's probably what survey 1, 2, 3 is that saying, you know, how many people can you get in the room and vote on one project? I don't know if it really tells us.
I think that the benefit of having like the dots or a survey 1, 2, 3 or some way to like, you know, it's basically just so that you hear from everyone instead of the loudest voice, or and it's, everyone gets a chance to weigh in on their preferred ranking or their top priorities, however you want to do it. It's just my 2 cents.
I don't know what to expect either, but we'll just give them the ratings and let them do it. At this point. But I'm really excited about not this, but upcoming this fall, we're going to be working on the 2050 RTP, and I think after having gone through this exercise, our list of projects that will be on the next one, I think that is a great time for us to really get a good list of base projects for this type of exercise in the future. So we will eventually put a pen in this and be done, but that exercise, I think, this is a really good precursor to what we're going to be working on later on this fall that will lead to sort of the future of how we prioritize it.
We won't have it finished this fall. We'll kick off the 2055 RTP with a lot of different things with our top demand model, our land use model, and you guys will all be involved in that, have the opportunity to be, or send somebody from your community, and then, yes, from those projects, then we can develop the next list.
That's so we don't know how what the format's gonna, we're just gonna talk through it and see what.
I have an agenda, which I do not have with me right now because I'm not connected to the servers of the office. But I do have an agenda, and timing and how to, I want to walk through it, and I'm going to show the scoring. I'm going to show how they rank with these 3 projects with the data that they have. I can do something like a Mentimeter or something else where they can go through and they can score them if they want to. I just don't know we've done the data driven, and that was not accepted. So then we need to go to what is the next way that we're going to do this, and they're the council, they can decide how they want to rank these. Do they want to do it by corridor? Do they want to just rank the corridor? Do they want to rank the specific projects? They have the ability to do that, and so I don't want to necessarily dictate to them how this is going to go when they still have the ultimate decision of how they want this to go. If that makes sense.
Those might be good preliminary questions to start with, is what, you know, here, and you did it the last one, and I know we've been in this for, it feels like a minute. It would be good to sort of start where you started last time, where do you want to do this by quarter? Do you want to do this by project within the corridor, or do you want just lists of projects? I love the idea of just lists of projects by corridor, because then you've got development community that can help you leverage money to get all of yours on 34 done. That's good for everybody else on 34, right? So having those projects where, you know, they're sort of all listed together, I think is a good way, because we want all of those to go forward on each of the corridors. So there'll be different funding opportunities for all of the different corridors. So. Yeah. We're so excited for this. We're excited for this. Great. Well, mission, put a pin in it and be done. That's what we are trying to do. Any other questions, comments, concerns? All right. And if all else fails, Aaron, we can do laser tag.
Yeah, right.
Laser tag is to prioritize the projects. All right. With that, we'll move into our outside partner reports. There's a written report for the Natural Bicontent Collaborative. our regional transit agencies. I don't know if we have anyone online want to share an update. Right. We have our mobility.
Well, Erin gave you a great breakdown of what's going on with mobility teams, so I don't have any major updates. So I think that was a good update for this month.
Awesome, thank you so much. Reports, the June Planning Council meeting summary draft is written and in your packet. Mobility Committee updates written and in your packet as well. Any legislative updates?
No, the report, this is the same report that was from the council, so this will be the final one for this year.
And then the NFRMPO air quality program updates in your packet. And then we will start our roundtable, and I will start by apologizing. I know we have a new member here from the town of Johnstown, so Tim was online, and I failed to do introductions for the table. So as we're going around for the roundtable, Tim, welcome. Is this your first meeting? Tim is with the town of Johnstown, and he's here joining us today. So if you want to introduce yourself as we do the roundtable for Tim, we can move up to that.
This is Becky, and no, I'm not.
Eric Tracy, Weber County, I don't have any.
Dana Hornbull with the City of Fort Collins, no updates for us.
Gina Fox with CDOT, no updates as well.
Omar Herrera, Town of Windsor, no updates from Windsor.
Scott Pearson, Town of Windsor.
Drew Rouser, NFRMPO, and at the, I'm not gonna remember the date, the June Planning Council meeting, Planning Council did agree to move forward with the RATC map back into you all, with the addition of extending RATC 13 north of the original proposed northern terminus at Welcoming Road 76 all the way up to State Highway 14. So now we'll be moving forward into getting the visioning process for the new section of RTC number 8 and RTC number 13. So I've emailed all the affected communities to find the time and have already scheduled some meetings. So I have not scheduled a meeting with your community yet. I've probably sent an email. If you have not gotten an email from me, let me know. We can find a time to discuss. And that's all I have.
I'm Michaela, and I have no updates.
Jonathan Stockton with the North Front Range NPO. So over the course of this meeting, I learned in the middle of it that the funding amounts for the TIP amendment that I presented at the beginning have slightly changed. So instead of the split between federal and state TCC, it's now the same total amount of that funding, but it's all state, so no more federal. Yeah, so this is an emergency project we learned about Friday. I guess we're still learning the information as we go. Hopefully that's still cool with everyone. That's all for me.
Aaron Holt, the NPO, and I already gave my update, I guess.
Victoria Linhart, City of Greeley, I don't have any updates.
Tanya Trujillo Martinez, NPO, no updates.
Kim Townsend, no updates. And Nicole Hahn with the City of Loveland, just a quick update. We're almost done with the TAC and US 34 project. We should be done by mid-July, late July. We are in a kind of our final and most impactful phase, wrapping that one up, but we're very excited to get that money spent and done and have the project reopened. Any suggestions for next month's agenda? Certainly want to talk about this prioritization of projects again. That probably will be, yes.
And then MMOS as well. And then maybe possibly, we'll see how much pain we're gonna have, the federal ones as well.
Thank you. Thank you all so much.